it's Dr. Atasha, and in today's video, I will be sharing a clip from a talk where I discussed anxiety and trauma and what they look like from the Christian perspective. I've included even some Bible verses in there that'll talk about what it looks like to experience anxiety and how do we overcome that with our faith. So as you watch the video, I encourage you to leave some comments down below. Let me know what you're thinking. Ask any questions that you may have, and please feel free to share it with a friend. Much love. So what I'll talk about briefly is understanding even just human experiences. So taking a step back, doing a little bit of science teaching, psychological teaching. Some of you may have heard of the cognitive triangle. The cognitive triangle really just allows us to simplify very simply the ways that human experience often can occur. So we have three elements. I've touched on these already: our thoughts, our behaviors, and our feelings. And what the cognitive triangle tells us is that our feelings impact our thoughts, our feelings impact our behavior. The things we do impacts the way we think. The things we do also impacts how we feel. So when we think about this, I want you to just kind of keep this in mind, and I'll come back to this idea of the cognitive triangle as we really sparse through what is it to experience anxiety? What is it to experience trauma? How does that change us as human beings? But then more so, how can we look at that from the perspective of people of faith who know that we have a savior who is there with us along the journey of anxiety, along the journey of trauma? He is there with us. And how do we put those two things together? So anxiety, what's anxiety? Simply put, anxiety is a reaction to fear or stress. And you might not realize this, but in fact, 1 in 3 people experience anxiety to a point beyond the normal human reaction. Anxiety exists in our lives to be a little bit of a signal, a warning that something dangerous might be occurring, that we might want to be aware of trouble. So, if you're on a plane, some people might get nervous about the fact that you're going to be floating in the air in this vehicle that kind of just uses hydraulics to stay up in the air. Some people might get worried about that. Some people might get worried about having to give a presentation, if they're worried that they might not do well, or if you're at work and you're worried about how your performance may impact your job prospects going forward. Those are things, anxiety in and of itself can often be a positive propeller to allow us to do things to the best of our abilities or to signal fear. But if it gets to the point where it is impacting your ability to function, so if, for instance, let's say I were to experience anxiety that was so crippling that I last minute canceled on this presentation and left you without anyone to talk, that would be anxiety that is impacting the level of functioning that someone is having. So that's what we're thinking about when we think about anxiety that becomes a disorder. And there are people, up to a third of people in the US who maybe do not experience anxiety to the level of it being disordered, but to have a severe and significant impact on their life. Some examples here, there's a panic disorder, obsessive compulsive disorder. You can have social anxiety, agoraphobia, which is the fear of going out into public around crowds of people. You can have specific phobias, so whether it's about flying on planes or snakes or bugs or of germs even, people have phobias about that. Those are some examples. Generalized anxiety disorder, that one, it's kind of like you're a little bit overly worried about everything. What does anxiety look like, though? I think that's the part that's really, really important for you guys to really at least have an overview of a general understanding to begin with of what anxiety could look like. So that could look like restlessness, that could be constant worry, increased irritability, where like everything is just bothering you for no reason exactly, but it's just kind of there and increased compared to your normal. If you're feeling more tired than usual or like even tense in your body, that could be a sign of anxiety. And I say could be because it's not necessarily a slam dunk, but it could be. It's a signal for you to pay attention to that something could be wrong. If you're having changes in your sleep, that's something else to consider. Some people experiencing anxiety as physical symptoms. So that could be chest pain, chest tightness, palpitations, could be sweatiness, nausea, stomach pain. It could be all of those. So it's important to really just think about the ways that you might be experiencing changes in your own body, recognizing how other people you work with, people you fellowship with, people who you live with might be experiencing these changes. What I want to speak a little bit more specifically about for just a moment is generalized anxiety disorder. And I want to give an example and something that's kind of relevant to what you might experience in the church. So let's say that Mark is a 68-year-old male member of the church. He has participated in the men's choir for over 20 years, and although he loves to sing in the choir, many of the other members are increasingly frustrated. So that could be you. You could be frustrated by someone in your church, someone in your family, someone at home, because they're maybe, let's say, asking constant questions related to the where, the when, the what, the why, the how. So always asking questions about every little detail, nitpicking to a point that is just overbearing on every little thing. One day you ask Mark how he's doing, and he shares that he finds that he worries about everything in life. So whether it's at home, at work, at church, he is worried about it. Sometimes he even feels nauseous or has chest tightness when he feels even more worried than usual. Sometimes it even feels like Mark's thoughts won't stop racing because of the worries. So I wanted to paint this picture because I wanted you to see it in a living example of how someone who experiences generalized anxiety could be walking amongst you in church, at work, at home, in the grocery store, and you not even realize it. Because the anxiety can oftentimes be very much internalized, and because even these symptoms and the feelings that this person has, they're felt within, and you don't necessarily always see it. But in this example, it was manifested outwardly by the repetitive questions about everything going on, driven by anxiety. So trauma being similar to, in some ways, to anxiety because of the ways that it could manifest, but trauma is separate, and we think of it separately when we're thinking of it from a diagnostic perspective in the field of psychiatry. So what is trauma? Trauma is an emotional response, and I got this definition from the American Psychiatric Association, and it says it's an emotional response to a terrible event like an accident, rape, or natural disaster. And these are just three of the many examples of trauma that can exist. And truthfully speaking, trauma is something that is very common. It is very common amongst people of color. I don't know the exact numbers off the top of my head right now, but there's this terminology called adverse childhood events, where it looks at traumatic experiences that children experience in the course of their lives growing up. And people of color, especially if you're from a lower socioeconomic background, are more likely, children in this category are more likely to experience more adverse childhood events than people who are not of color or people of higher socioeconomic backgrounds. And what we want to think about here is how could these experiences be manifesting for people in the church, be manifesting for people who are at, as I said before, your workplace. We want to make this so that you can think about your own experiences as well as the experiences of the people around you. So some signs and symptoms of trauma that may present. And as I said before, it's kind of similar in some ways to anxiety, but also different. So we could have low mood, increased emotional reactivity, that same irritability could come back, anxiousness, nightmares. If it's really bad, people could have nightmares really related to the trauma that's occurred, daytime flashbacks or memories of the event that happened that can be distracting for them throughout the day. You can be more aware of your surroundings. You can be someone who's always looking, always checking doors, always looking to see if someone's coming in. You can have an increased startle response. So if someone like taps something, or if you're in church and somebody accidentally hits the cymbal too hard or something like that, and you're startled by it more than usual, that could be a sign of a trauma response. Not always, but I'm trying to just get you geared towards potential signs, because I'm not expecting that after this presentation, you're going to be able to go out and diagnose. I just want you to be able to be aware of what could be occurring in yourself or someone that you care about. Another thing is all of this is difficulty. It leads to potentially difficulty in functioning in your day-to-day tasks. So examples of some trauma-related illnesses, we have acute stress disorder, adjustment disorders, post-traumatic stress disorder, dissociative disorder. So people can even get to a point where you feel like you are existing outside of your person. So dissociative disorders and persistent complex bereavement can also be a result of trauma. Again, here I want to kind of hone in onto one specific diagnosis example, that being post-traumatic stress disorder. You might know it more commonly as PTSD. And what might that look like for someone in the church? So we have Wendy here, and these are all fictional examples, by the way. So Wendy is a 23-year-old female visitor of the church. She has attended Sunday services weekly for the past 3 months. Every week, she sits in the back row. She frequently looks at the door throughout the service. When the drummers start playing praise and worship, her whole body shakes, like they hit that drum, and she just has this huge startle. One day, Wendy comes up to you. She shares that she has been feeling increasingly sad over the past month. She also shares that 4 months ago, she was mugged at gunpoint, and she's had difficulty making it through each day since then. So again, I do not expect by any means that, based on like the what I just shared with you 1 minute ago, that you would be able to diagnose Wendy with a specific illness. But what I would hope that by now kind of just having this information and being armed with this knowledge, you can recognize that Wendy is struggling. And as I said before, prayer can be incredibly helpful for Wendy. Giving her some verses that can help her through the sadness she's experiencing can also be incredibly helpful for Wendy. Directing her to Bible study groups, directing her to women's support groups, inviting Wendy out to the different ministries that the church is having, all incredibly helpful. But we are doing Wendy a disservice, or any other person in your church a disservice, if we don't also recognize that Wendy, this fictional person, but also maybe the person who sits next to you every day in church, might need help, might need a therapist. She might need a prolonged exposure therapy that can help to reduce the physical expression of anxiety and trauma that she's experiencing from this mugging, that can then help her to go on to live a happier, healthier life while still praising the Lord in the midst.
Hey, quick commercial break to remind you that if you're enjoying what you're seeing so far and all that you're learning, go ahead and like, subscribe, hit that notification bell so you don't miss out on any of the other videos that I post. All right, back to the content.
So going back to what I talked about before about the cognitive triangle, we're thinking about how our thoughts impact our behavior, impact our feelings. So when we think of it with anxiety and trauma as the lens that we're coming to this from. So an example I can give, if we talk about the Wendy example, okay? So the Wendy example, she was someone who was mugged at gunpoint. That is a traumatic index event where she experienced this large trauma that can lead to, as we had said, she was having feelings of sadness and low mood. Her feelings of sadness and low mood impact her behavior. So now when she's in church and she hears loud noises, she's startled. When she is in church, she's looking at doors to see if someone's going to come in and harm her, because her trauma response leaves her feeling vulnerable, leaves her feeling sad, leaves her feeling a need to always be on guard because she's now worried about this happening again. Her thoughts are worried as well because she's, concerned that something like this might happen again. So that's a way of how we can think about the ways that that trauma is related to this triangle of how our feelings, our thoughts, and our behaviors are all interconnected. And by, when we pray, it impacts our feelings. When we pray, it impacts our thoughts because we're turning our minds to Jesus. We're tuning to him. We are really able to communicate and speak directly with the Father and grow that relationship. But similarly, when we also have medication can help with your feelings. It can help your feelings to be improved so that your thoughts are no longer as negative or distressing, so that you're able to do the things that you want to do. Similarly, therapy can impact the thoughts, the feelings, and the behavior. So I want to just keep emphasizing this, that I see wellness for Christians as a three-pronged approach. When we experience either anxiety, trauma, depression, whatever it may be, if we're not incorporating all three as they are needed, faith, medication, and therapy, we are doing ourselves a disservice. I want to speak briefly about depression. Depression can oftentimes happen to people who experience trauma and who experience anxiety. One of the things about psychiatry is that it's quite common for illnesses to co-occur, meaning you can have more than one mental illness at a time or more than one mental health challenge happening at the same time. So I want to make sure we briefly touch on depression, where you're feeling so severely sad and dejected, where your sleep might be changed, your appetite might be changed, you might be losing interest in activities, your energy's down, your concentration's off, you're feeling guilty. You might even be to the point of having thoughts to harm yourself, thoughts to hurt yourself, thoughts to even end your life. And it's important for us to recognize this because, as I said before, 1 in 5 people in the US has a diagnosable mental illness in every given year. And that is not any different for Christians. And we experience it, but we also have the treatments available. So I want us to just even know what this could look like, because it is very likely that multiple people in this virtual space have experienced depression at some point. And I want us to know when we can see it in someone else, to have the ability to go talk to them, to recognize, hey, I see you might be hurting. Can we talk? Can you maybe direct them to someone who is a trained professional who would be able to help?
Hey, it's so good to see that you've made it to the end of this video. Thank you so much for watching. If you've enjoyed it, please share with someone. And I think that you're gonna like this video right here because it's gonna help you to learn more about the topic you just watched. Have a good one.